Every effective skin cancer treatment leaves evidence behind, but the early mark is not the final scar.
This explainer was written and edited by Dr. Thomas Hocker, a triple board-certified Harvard and Mayo Clinic-trained dermatologist, Mohs surgeon, and dermatopathologist.
To really wrap our heads around how scars evolve, I want you to picture your skin like a beautiful kintsugi vessel. You know, that Japanese art where break is repaired with golden seams. The final look isn't just about the fact that it was treated at all. It depends on a bunch of moving parts: the exact treatment used, the size of the tumor itself, where it is on your body, and of course, your own unique healing process.
Wait, hold on. But doesn't Mohs surgery always guarantee the smallest scar?
The direct answer to that is actually no. It's true that Mohs surgery brilliantly conserves healthy, uninvolved tissue right at the examined margin. But every single scar tells the story of two distinct problems. First, you have what the cancer required: its size, how deep it went, any hidden extensions, and the margin needed to clear it. And then second, you have how the tissue actually healed: the final wound size, the reconstruction method chosen, skin tension, and your own personal scar biology all play massive roles here. I mean, two people could both have Mohs surgery, but a cheek wound left to heal naturally and a multi-stage nasal wound repaired with a flap, those are simply not the same scar. It helps to think of a scar as a moving picture rather than a snapshot. In those early stages, the area might look pink, swollen, or feel pretty firm. But then you enter the remodeling months. This is when collagen reorganizes itself and those really prominent blood vessels finally start to fade out. It's really only later down the line that persistent differences in contour or texture become obvious. In fact, a large multi-center study tracking patients who had facial Mohs surgery showed their appearance and symptom ratings literally kept improving through 1 full year. So that early redness, firmness, or numbness you're noticing, it's not the final outcome.
Section 1, Surgical Scars, Mohs and Excision. Let's look at the first metaphorical break in our kintsugi vessel.
Understanding the actual physical geometry of a surgical repair is absolutely critical here, whether that's from Mohs or a wide local excision, which you'll often hear called a WLE. If a surgeon needs to close a round wound without leaving little bunched up puckers of skin at the ends, they often have to create a longer linear closure. The scar ends up longer than the original spot, entirely by design. And depending on the margins and the location on your body, repairs might involve a flap, which actually moves nearby skin over, or a graft that transfers skin from a completely different site. Sometimes natural healing is the best route, where the wound just fills in on its own over time without a single stitch. And keep in mind, these repairs could happen immediately, or they might be delayed or done in stages. Section 2, Destructive Treatments, Round Wounds and Contour. Okay, so what happens if I decide to go with destructive treatments, like scraping or freezing, instead of a surgical cut? Right, so scraping, which is clinically known as ED&C, or electrodesiccation and curettage, skips that designed linear closure entirely. Instead, it usually heals as an open wound, and eventually it leaves a round mark that could be pale, pink, shiny, or even a bit depressed into the skin. Then you have cryotherapy, which is freezing the tissue. That can actually injure the cells that produce your skin's pigment. Especially in deeply pigmented skin, freezing can leave a noticeably lighter or darker patch, right alongside some texture changes. So the takeaway? Neither of these methods are truly scar-free. Section 3. No stitches, still a mark. Topicals and PDT. So if there are no stitches involved at all, do topical creams leave absolutely no scar?
The hard truth we have to face is this: no stitches does not mean no scar. Topicals and photodynamic therapy, or PDT, absolutely avoid a linear surgical incision, that's true. But what they do instead is create this intense inflammatory field across the skin to destroy the cancer cells. And that field, it can result in prolonged redness, peeling, and long-term pigment or texture changes. You're basically trading a surgical line for a treated field, which is still very much a visible mark.
Let's pause for just a second and do a quick mid-explainer reset. We need to look at the core question patients are always asking when they're trying their hardest to avoid surgery, and that is, do non-surgical options actually result in a better appearance? Well, the data here might actually surprise you. There's a landmark randomized study from 1997 looking at facial basal cell carcinoma, and it directly compared surgery to radiation. Fast forward to the 4-year mark, and 87% of the surgery patients rated their cosmetic result as good. Compare that to only 69% of the radiation patients. On top of that, tumor failure was lower with surgery. Now, yes, this is an older study, and radiation techniques have definitely evolved since then, but it firmly breaks that automatic assumption that avoiding a surgical incision guarantees a better look, because ultimately, durable cancer control is what protects your future appearance.
Section 4, The Long Tail of Radiation. Modern radiation is an incredibly valuable tool, but as a patient, you have to think far beyond the final day of your treatment.
See, because radiation treats an entire field of tissue, it actually alters the skin's underlying biology over a span of years. You might start to experience late pigment changes, notice visible small blood vessels appearing, or deal with thinning skin, new firmness, or a reduction in elasticity. Hair loss in that treated area is also super common. Basically, the cosmetic result of radiation keeps evolving long after the cancer itself is gone. Section 5. Normal healing or modifiable scar problem. Okay, with all these different outcomes, how do I actually know if my scar is healing normally or if it's a modifiable problem I should do something about?
That's a great question. We really have to separate the expected early treatment marks from persistent modifiable problems. Things like early prominent blood vessels or some firmness during the remodeling phase. That is totally normal healing. But if that redness persists long after the scar should have matured, or if that firmness turns into function-limiting tethering, like something pulling down on an eyelid, or if you're left with a stable, bothersome depression that actually distorts your normal facial landmarks, well, those are specific phenotypes. And the good news is, each of those specific problems has targeted medical or cosmetic solutions. Section 6. Red flags requiring assessment. Now, before we ever talk about cosmetic fixes, there is a critical warning we absolutely have to cover. Because some changes should never, ever be dismissed as just a maturing scar. There are specific warning signs you must never ignore. If you suddenly develop a new or enlarging lump, an open sore that repeatedly bleeds, increasing pain or numbness, progressive fixation to the tissue underneath, or new functional changes right beside a treatment field, these are massive red flags. For instance, if a new bleeding bump pops up at the edge of a radiation field, that requires a proper clinical assessment for a recurrence or even a brand new skin cancer. It does not need automatic scar cream. Always get things like this examined by a professional. Honestly, the best tool you have to track all of this is sitting right in your pocket. Take serial photographs of your treated area and consistent lighting over time. This gives both you and your clinician a truly objective way to separate a scar that is just steadily maturing from a concerning new change that needs attention. Now, if your cancer site is stable and you're ready to explore real solutions for your specific scar phenotype, your next step is to read the complete Skin Trust Guide titled Which Scar Treatments Work Best After Skin Cancer Treatment. It's going to equip you to have a highly productive conversation with your treating clinician so you can make individualized decisions together. Dr. Hocker created Skin Trust to provide free, evidence-based dermatology education and help patients and clinicians make clearer decisions together. So, when you look in the mirror months after your procedure, ask yourself, are you just looking at an early mark, or are you looking at the final story of your skin's healing? Thank you so much for joining us for this explainer.